If you've ever had recurring stomach pain, bloating, or unpredictable trips to the bathroom, you're not alone. These are hallmark signs of Irritable Bowel Syndrome, or IBS, one of the most common digestive disorders in the world. But here's the problem. Because the symptoms are so common, they're often misunderstood, dismissed, or even misdiagnosed. In this video, we're breaking down exactly what IBS is, what it isn't, and why a correct diagnosis is absolutely critical. So let's begin. Irritable bowel syndrome is what we call a functional gastrointestinal disorder. That means if a doctor looks inside your intestines with a scope or a scan, everything appears normal. There's no visible damage or inflammation, but the system just doesn't function the way it should. It's not the same as inflammatory bowel diseases like Crohn's or ulcerative colitis. Those are autoimmune diseases that physically damage the intestines. IBS doesn't cause permanent harm, but it can cause major disruption to daily life, leading to discomfort, stress, and anxiety. IBS is incredibly common. Studies estimate that it affects between 10 to 15% of adults worldwide. Women are diagnosed about twice as often as men. Symptoms usually begin in late teens or early adulthood, and for many people they come in cycles, flaring up, calming down, and then returning again. So, what does IBS feel like? The core symptom is abdominal pain or cramping that usually improves after a bowel movement. People also experience persistent bloating and gas, along with major changes in their bowel habits. Some people mainly deal with constipation, others mostly have diarrhea, and many live with a mix of both, switching back and forth unpredictably. In addition to that, people with IBS often report fatigue, nausea, or the frustrating feeling of not being finished after using the bathroom. Triggers can include certain meals, stressful times, or hormonal changes, especially in women. Now, what causes IBS? The truth is, there isn't a single answer. It's usually a combination of factors. The most important is a miscommunication between the gut and the brain. The nerves in the intestines are overly sensitive, and the brain interprets normal digestive activity as pain. We also see abnormal gut motility, meaning the intestines move too quickly in some people, causing diarrhea, or too slowly in others, causing constipation. Imbalances in the gut microbiome, the community of bacteria in the intestines, likely play a role as well. Stress and anxiety don't cause IBS, but they make symptoms much worse. And finally, certain foods such as dairy, caffeine, fatty meals, and artificial sweeteners are common dietary triggers. Now we've reached the most important part of this video. Diagnosis. IBS is a diagnosis of exclusion. That means a doctor cannot and should not simply label your symptoms as IBS without first ruling out other conditions. Tests like blood work, stool tests, and sometimes even a colonoscopy may be required. Why is this so important? Because other conditions mimic IBS almost exactly. Celiac disease, lactose intolerance, and inflammatory bowel diseases can all look like IBS at first. And perhaps most importantly, gastrointestinal cancers, such as colon cancer or other cancers like ovarian cancer, can sometimes be mistaken for IBS in their early stages. This is why self-diagnosis is dangerous. If you have persistent digestive symptoms, you must see a doctor for proper evaluation. It is the only way to be sure. So, what about treatment? While there is no cure for IBS, the good news is that symptoms can almost always be managed and controlled. Management usually involves a combination of lifestyle changes, dietary adjustments, and in some cases, medications. Lifestyle strategies include keeping a food and symptom diary to identify your personal triggers. Many people find huge relief from trying a low FODMAP diet under professional guidance. This diet temporarily restricts certain hard-to-digest carbohydrates. Eating smaller, more frequent meals instead of large ones also helps. Managing stress through mindfulness, yoga, or therapy directly calms the gut-brain axis, and regular exercise improves gut motility while lowering stress levels. For medications, the options depend on your symptoms. For abdominal cramping, antispasmodics like Hyoscine, Buscopan, or Dicyclomine may help. For constipation-predominant IBS, medications like Polyethylene Glycol or newer drugs such as Linaclotide or Lubiprostone can improve symptoms. For diarrhea-predominant IBS, options include Loperamide for controlling loose stools, or in some cases, Rifaximin, an antibiotic that targets gut bacteria. Probiotics, can restore gut balance in some patients. And in selected cases, doctors may use low-dose antidepressants like Amitriptyline or Sertraline, not for mood, but because they help regulate nerve signaling between the brain and the gut. Living with IBS can be frustrating and unpredictable. Flare-ups may disrupt your work, social life, and travel. But here's some reassurance. IBS does not cause cancer, and it does not shorten your life expectancy. With the right strategies, you can take back control. That said, there are certain red flags where you must see a doctor immediately. These include blood in your stool, unexplained weight loss, severe or worsening abdominal pain, or if your symptoms first appear after the age of 50. These warning signs may point to conditions more serious than IBS and should never be ignored. So here's the final message. IBS is real. It's common, and it's treatable. But it is also a diagnosis that must be made carefully and responsibly, only after excluding more serious diseases, including cancer. If you see yourself in these symptoms, don't suffer in silence and don't self-diagnose. Talk to your doctor, get the right tests, rule out the serious conditions, and then work with your doctor to build a management plan that works for you, because with the right care, you can absolutely take control and live well with IBS. And if you found this video informative, don't forget to like, share, and subscribe for more health topics that matter to you.